What's up, guys? Dr. John Schaefer here, doctor of physical therapy, strength conditioning specialist, and certified clinical instructor. Today, we're going over 5 things you need to do to ensure getting the most out of each new clinical rotation. And this video will be especially helpful if you're seeing this prior to your first rotation. So let's dive right in. Number 1, set expectations early on. It might sound simple, but it's impossible to have an idea if things are going well or not if you don't have anything to compare them to. So during that first week, you and your CI should set aside some time, go over what you're hoping to get out of the rotation, as well as expectations for one another. This will ensure you're both on the same page, ready to have a positive experience. If these conversations are not happening within the first day or 2 days, make sure you advocate for yourself and let your CI know that you'd like to discuss these things. Another thing that's going to help a lot is reaching out to the clinical site early. So if your CI emails you, make sure you respond. And in your response, you can even include things like background, what sorts of clinicals you've had already, if you have had clinicals, some of your clinical interests, or even just questions you might have about the rotation. Your CI is going to be very happy to hear from you and get that additional information to prepare for the rotation. Some schools are going to require that you send some of that information beforehand. Others are not. So it's going to be your responsibility to figure out what sorts of resources you need to be sending. But if you don't communicate with your CI, they have no way of knowing where you're at, and there's going to be a lot more guesswork on their end. But if your CI knows what you're hoping to get out of the rotation, how you learn best, how you prefer your feedback, you're really just giving yourself that much more of an opportunity to be successful. Number 2, pay attention to the CI-patient interactions early on. So the first few days are likely going to be a lot of observation. This is a chance for you to listen and see how your CI interacts with those around them. So look at how they talk to their patients, how they describe complex conditions, their body language, and how they manage their time. These are all activities that you're going to eventually need to do in just a short amount of time. So you got to kind of pay attention, see what's working for them, see what's not, but try to be actively engaged in watching these things because there's a lot you can learn during this time that's going to help improve your experience further down the road. So write down things that your CI does that you like, but also pay attention and follow up on things that maybe don't make as much sense to you. So you're not on this rotation to become a carbon copy of your CI. You can certainly take bits and pieces away from the way they practice to help you improve your future practice. Number 3, start interacting with patients from day 1. It's okay to engage with patients, even if it's just small talk, asking about family, asking about friends, different activities they bring up. We all have a tendency to feel a little bit awkward at times during these first few interactions, trying to find our place as we navigate our role within the clinic. Totally normal to try and figure out like where's most appropriate for you to jump in, when to maybe sit back a little bit. But if you start early, especially during the first week or so, it becomes a lot easier to start to transition to patient care with these individuals if you've already built up some of that baseline rapport. So invest a lot of effort in the relationships during your first week, and it's going to pay off tremendously. Another thing to think about is how you want to be introduced to patients. Do you want to introduce yourself? Do you want your CI to introduce you? If you have any sort of a preference, just let your CI know, and they're going to try and accommodate to help you feel like a valued member of the care team. So that's going to look different for everybody. So figure out what's comfortable and what works best for you. Number 4, ask questions. As you begin to observe and interact with patients, just ask questions. No questions too big, no questions too small, and think about how you can get the most value out of those around you, especially your CI. So ask clinical questions, ask time management questions, personal questions, try and get some hot takes on the field. Use your CI as a resource because they're just a few steps ahead of you and doing a lot of the things that you hope to accomplish in the future. So figure out what sorts of things have worked for them and help them get to the place that they are today. And just keep track of questions for downtime. So if you can keep a running list of questions or write down things that come up, you can always come back to them during patient cancellations, lunchtime, anytime you have a little bit of downtime, go through that list. Finally, number 5, possibly the most important on this list, self-reflect. So at the beginning of each rotation, I'd highly encourage you to think about things that you're currently doing well as areas you can improve. If you know what you need to work on, such as exercise prescription, manual techniques, make that a goal for the rotation and let your CI know. Write down a plan that, hey, you're going to practice this technique this week, this technique the next week, and make that a goal. Make sure you're addressing it because we all have strengths and deficiencies, but at the end of the day, a good CI, a good mentor is going to help you address those deficiencies and become the best clinician you can, improve your clinical care as much as possible, and really set you up for success in the long run. Clinicals are an exciting time. You're finally transitioning to less time studying textbooks, more time interacting with patients, but it can definitely be a stressful transition as well. I recognize that. But using the tips and strategies in this video will help you better prepare and ensure for a positive relationship with your CI, as well as get the most out of this experience. So think about some of these things and how you can incorporate them as you start this next rotation. I'm sure you're going to crush it. Like and subscribe for more physical therapy content, more clinical rotation content, and more content about the field. If you have any questions, drop them in the comments. I'm more than happy to respond, carry on this conversation, and we'll see you in the next video.